Hello everyone, thank you very much for joining us and giving us your time. I'm Elizabeth Clements, the presenter of Live Blood Online and Neogenesis Systems, and together with Dr. Ocker, our tutor, who I'll be introducing shortly, we'll be showing you how and why you may want to consider adding live blood analysis to your practice. If you're new to GoToWebinar, you may want to familiarize yourself. You'll find a question box in the box there. Where you can ask questions, and also if you click on the full screen button, this is the best way to view your webinar. So have a look in there, find the questions box, and then you'll be able to post your questions in there. So Dr. Ocker is a qualified naturopathic and homeopathic doctor, is our course tutor. He's been teaching live blood analysis and utilizing it in his practice for over 18 years now. So I'm going to hand you over to Dr. Ocker, who will explain the most important benefits of live blood analysis and how it can help you and your patients in your practice. So hello, Dr. Ocker. Thank you very much for joining us. Could you please explain to our listeners how live blood analysis can benefit them and their clients?
All right. Yes, absolutely. Hi, Elizabeth, and thank you for that. We're going to go through the information now. We have a few points that will explain the benefits of live blood analysis and why it's such a powerful tool and such a useful tool for natural health practitioners. So I think the first point really is just that live blood analysis enables you to detect underlying imbalances at the cellular level. Now, these are the same imbalances that complementary and integrative practitioners need to work with to allow the body's own mechanisms to facilitate healing. Now, these underlying imbalances are also instrumental in the development of disease and therefore usually precede disease. Now, this means that as practitioners, we have a technique here that is truly valuable in preventative medicine because we're able to identify imbalances at a very early stage before the onset of pathology. And we can then take the necessary steps to reverse the process. Now, most other so-called preventative measures in conventional medicine are really only early detection measures as they detect imbalances brought on by pathological processes that have already taken hold. Now, being able to view the condition of the blood and the blood cells in an unaltered natural state with the cells behaving like they would in the body allows the practitioner to achieve a much deeper understanding of the patient's individual health challenges and deficiencies. Most of the conditions detected by live blood analysis are not detected by as easily or as sensitively by any other means. So we're therefore able to assist patients who have not had any success with other conventional or complementary practitioners, despite having had numerous tests and investigations. So as a second point, the information gathered from a live blood test is vital in determining and deciding on the best course of treatment for a patient. Now, live blood analysis gives us a glimpse of each patient's unique internal cellular environment, so we can see the condition of this environment in real time. So the most important priorities are immediately obvious to the practitioner. And this makes it easier for the practitioner then to choose the best course of treatment for a patient. And then somewhat related to the previous point, the third point is that live blood analysis allows you to monitor the efficacy of any given treatment. So because we're able to observe changes taking place in the body's internal environment or the terrain in real time, we can very easily monitor and track the patient's progress during treatment. Now, by assessing the changes taking place after implementing specific treatment protocols, we can establish whether a specific treatment protocol is actually working or not, and we can then make the necessary adjustments at a much earlier stage than what would have been possible without blood analysis. Now, as practitioners, we have access to such a wide variety of medicines and therapies as well as to so many different types of dietary regimens, that it can be quite challenging to work out exactly what needs to be done for each patient that you see in practice. And patients often end up going from practitioner to practitioner and getting various diagnoses and treatments without ever really knowing whether the condition is improving, unless the symptoms actually improve dramatically. Now, we all know that in chronic conditions, the symptoms really only start improving after the fundamental cellular imbalances have been corrected. And this usually takes some time, and with live blood analysis, we actually able to show the patients during the course of treatment that their condition is improving at the cellular level, even if they might not yet be feeling a significant improvement. And then the fourth point to make is that live blood analysis provides you, as the practitioner, with the means to demonstrate the negative effects of unhealthy dietary and lifestyle choices. This is a very, very powerful one to have in practice, because as practitioners, we understand what constitutes a healthy diet and lifestyle. And in fact, many patients do as well. But unfortunately, we still encounter a lot of resistance from patients when we advise them to change their diet. Many people have an emotional connection to certain foods, and of course, changing one's diet is actually one of the most difficult things to do. And that is why patients might agree with you during the consultation to make certain changes to their diets, but soon after leaving your office would soon start justifying, not having to follow your recommendations. This lack of patient compliance is really one of the leading causes for poor outcomes with holistic treatment programs. We simply don't have a pill to substitute a healthy diet. So we need to make a very powerful impression, almost a shock or wake-up call to motivate the patient to start making the necessary changes. Now, seeing the state of their blood live on a screen compared to what a healthy sample should look like shows them the impact of their dietary and lifestyle choices, and it helps to motivate them to do whatever is necessary to correct the imbalances. Now, the positive changes that they've made is then reinforced by the practitioner being able to show them the positive changes that have taken place in their blood after following the protocol for a few weeks. Now, this ensures that the patient stays compliant during the entire course of treatment until they are better. But also, since they have seen the effects of making these changes, they are much more likely to continue with them, and thereby, in the long term, then maintain their health. And then the last point to make is that live blood analysis creates a very interesting and interactive dynamic in your practice. Now, one of the problems with conventional medicine is that traditionally all the knowledge and the responsibility for the patient's health lies with the practitioner. And many doctors don't explain to their patients the diagnosis with them and what they can do as patients to help improve the condition. Now, this is not the case with complementary and integrative medicine, as we believe that the patient is ultimately responsible for his or her state of health, and that the practitioner should not only dispense medicine, but should also educate the patient about what he or she should do to achieve and maintain optimal health. So live blood analysis creates an interactive and interesting dynamic in practice. Once the drop of blood has been taken from the client's finger and placed on a slide under the microscope, the sample is then viewed by the practitioner and the patient in the practice on the screen. So the practitioner discusses the various anomalies of the patient's blood in detail with them, highlighting the symptoms that may be experienced as a result of the anomaly, as well as the dietary and lifestyle factors that may have contributed, as well as the steps that need to be taken, of course, to correct the anomaly. Now, this makes it very clear to the patient that they shouldn't just expect to take some pills and get better, but they also would need to make the necessary dietary and lifestyle changes in order for them to achieve health.
Thank you very much, Dr. Rocker. So that was very interesting. So those are the 5 key benefits of live blood analysis and how they can help you and your clients. And we have some questions. So the first question is it possible to diagnose any medical diseases with live blood analysis?
Right, that is a very good question, and one that often tends to come up because we are looking at blood, and people expect us to see specific things with blood analysis. But it's important to mention that live blood analysis is not used as a diagnostic tool. Although there are some indications for specific disease processes that can be seen in the blood. Because there is a fair degree of overlap with standard hematology, it's not really meant to be used to diagnose any specific disease. Now, in cases where indicators of a specific disease are seen, one would still need to follow the normal investigations and procedures to diagnose the disease. Now, the strength of live blood analysis actually lies in what we discussed earlier, in its ability to provide the practitioner and the patient with a glimpse into the patient's internal cellular environment or the biological terrain, and to identify imbalances affecting the terrain that are contributing to the patient's condition, and in many cases were actually instrumental in the development of the patient's symptoms.
Thank you. And if it can't be used for diagnosis, why is it useful in a clinical setting? How will it help my patients?
All right. Well, this is a question we often get from practitioners that are more conventionally trained, because as conventional practitioners, usually they're trained to look for specific diagnosis, which will then guide them into specific treatment. But live blood analysis is really an ideal tool for a complementary or integrative medicine practice, where the focus is not really on a specific medical condition, but rather on identifying underlying imbalances in the system that would have contributed to the development of the disease. So it's more aimed at identifying the causative factors for specific diseases. Now, overall, this really comes down to your goals as a practitioner with your patients. Do you want to help your patients achieve and maintain optimal health, or do you just want to be able to diagnose and manage diseases as and when they develop? Now, we often talk about the difference between healthcare and disease care, and this is really what it boils down to as well. Practitioners who are involved with integrative medicine and complementary medicine are really not satisfied with simply treating the patient's symptoms with various pharmaceutical agents. They want to understand the physiological processes that precede the development of a specific disease, and what role various factors from the patient's diet and lifestyle played in the development of a disease. So understanding these causative and contributing factors then allows the practitioner to treat his or her patient more holistically, and it also helps them to understand how these conditions can be prevented then in other patients.
Thank you. And we have a question that comes up quite often. How reliable is live blood analysis? And how much variation is there in the findings in a patient's blood from one day to the next?
Yeah, no, look, there are some practitioners who are skeptical of live blood analysis, and I mentioned this is one of the potential problems with the test, that there are many factors that will affect the outcome of a live blood test, which may then mean that a patient's results will then vary dramatically from one day to the next, based on what they had to eat, when they ate, and how much water they drank, for example. Now, in practice, however, we simply don't see this type of variation. Now, of course, if a vegan, for example, decided to have a large steak and a few hours before live blood test, we can then expect to see the impact of this in the blood. But for patients following their normal daily routines, the results are always very accurate. we actually see the opposite of what is suggested here in practice. Patients tend to present with a very specific mix of anomalies that don't change unless the appropriate course of treatment is completed. So they would have a list of perhaps 10 anomalies at the first appointment, and if they don't make the necessary changes and take the required step to address those anomalies, we will then see the same 10 anomalies when they come back, even if it's several years later. It's like a metabolic or functional fingerprint that we're seeing, and it really won't change unless very specific steps are taken to address it.
Thank you. And do you do live blood analysis on every patient that you see?
Oh yes, absolutely, absolutely, I do. I can't really imagine not using live blood analysis because it helps to guide me so much in practice. There really isn't no other test that can compare with live blood analysis in its ability to detect the most important health challenges that any particular patient has, as well as being able to monitor how the condition improves with treatment. Conditions that used to present quite a challenge for me before have become very easy to deal with because I can see exactly what the root cause of the problem is by looking at the blood. Before using live blood analysis, I had to rely on purely the clinical picture and what we could probably refer to as crude laboratory tests and investigations, and perhaps a bit of luck as well. And I've often found myself second guessing my decisions in terms of treatment, wondering if there was something in the case that I may have overlooked. But with live blood analysis, because we are scanning the sample for any visible anomalies, instead of choosing what specific tests to do on a form, there's actually very little risk of not finding the most relevant anomalies. I've seen it work so many times and so consistently in practice, and I've seen it help people who have tried nearly every other test, that I feel that if I don't do a live blood test on every client that comes to see me, that I'm likely to miss the boat with him completely.
Thank you. And what does live blood analysis involve, and what is the clinical research?
Well, in terms of what it involves, well, it's basically a visual analysis conducted on two blood samples, a live blood sample and a dry blood sample. Now, the live blood part of the test involves looking at the live blood sample under fairly high magnification using two types of applications in microscopy, namely bright field and dark field. Now, the dry blood sample is viewed after the live blood sample under fairly low magnification, looking at the specific patterns of coagulation in the dry sample. Now, in essence, this is a nutritional test, so we can see various nutritional imbalances and other imbalances that can be addressed with changes in diet and lifestyle and specific natural treatment interventions. As I mentioned earlier, it's not really a tool used to diagnose medical diseases. The type of conditions that we're able to diagnose or detect with live blood analysis are in fact conditions that are understood in the field of natural medicine and not completely accepted in the field of conventional medicine. Now, this is also one of the main reasons why live blood analysis is not really fully accepted by the conventional medical field. We are using a device here that can actually detect conditions that they in conventional medicine do not recognize as being real conditions. So, like for example, the issue an issue with candida, or the need for detoxification, heavy metal toxicity, latent tissue acidosis, and so on. So we have a tool here that can actually accurately detect those conditions. So, it's going to be very difficult and, rather unlikely that it would be accepted by conventional medicine. Any normal GP, general medical practitioner, if a patient tells them that they feel that their problem stems from an issue with toxicity, and that they need to go for detox to see an improvement in their symptoms, I don't think the medical practitioner will take them seriously, and that's really what it comes down to here as well. Now, also in terms of clinical studies, it's very difficult to put together a clinical study for live blood analysis, because many of the conditions that we're able to detect with live blood analysis cannot be detected or verified by conventionally accepted tests to the same degree of accuracy and sensitivity as live blood analysis. So that's one of the main reasons why there's only a small amount of research on live blood analysis, specifically clinical type of research or scientific studies. Now, there is, of course, a large part of blood analysis that is based purely on standard normal hematology. So, as you know, that information has been researched many years ago, and there really is no need to subject that information to any further research. However, because of the differences between live and stained blood samples, there are many other signs and indications that don't form part of hematology, and there have been some small-scale studies that were done, and we can definitely go through those in more detail in another webinar.
Thank you, and that maybe answers the next question a little bit, which is, why do some doctors think live blood analysis is not legitimate?
Well, yes, I think we have addressed that to some extent with what we've just mentioned, and we do have another webinar where we discuss this topic in a lot more detail. So this is perhaps something that we can send out as well.
That's absolutely, we'll do that. We'll send that out to all of the listeners. The next question is, how close is live blood analysis to normal medical hematology?
Well, this is actually quite an interesting question, and because, as I said earlier, a fair degree of information in live blood analysis is purely based on standard hematology. So in terms of the specific anomalies that we also see and recognize in conventional hematology, the interpretation would be very similar. So from that perspective, it is very similar to conventional hematology. But there are also some very fundamental differences. The fact that we're looking at live blood makes a very big difference. In conventional hematology, the blood is, of course, drawn from a vein. It's placed in a little test tube with an anticoagulant, and then the blood is sent off to a laboratory where a different technician will actually look at the blood under a microscope. But before analyzing the blood, they stain the sample and basically kill all the blood cells to preserve the sample. So you could actually say that conventional hematological testing, what they call a peripheral blood smear, is a much cruder type of analysis. It's performed on essentially dead blood at a very low magnification, and the way that the sample is prepared is also quite, there's a lot of damage that occur to that the blood cells undergo as a result of the sampling process. Many of the anomalies that we view as being significant in live blood analysis are actually disregarded in conventional testing because they're seen as an artifact created during the staining process or as a result of byproducts of the staining process. Now, whereas in live blood analysis, because the blood is collected from the finger and placed immediately on a slide and viewed straight away under microscope, under high magnification, and of course nothing is added to the blood is viewed exactly like it is in the body. So any anomalies that are seen are there because that is the condition of the blood and not because of anything that was added to the blood or how the blood was altered in any way. Now, one of the earliest proponents of live blood analysis, Marcel Bessy, was a French hematologist who lectured at the University of Paris in the 1960s and 70s. Now, he wrote a number of books describing the value of evaluating blood in a living unchanged and non-stained state. Now, he argued that all hematology labs should consider changing over from analyzing stained blood samples to live samples, mainly because with live samples you are able to observe in real time the dynamic processes of life at the cellular level. Now, he said that you can capture events and sequences that are impossible to see in static, dead, and stained slides, and this is certainly something that we see in practice every day.
Thank you for that. Final question. If you have any more questions, please put them in the box. What's the best way to get started in studying live blood analysis?
Well, to benefit from live blood analysis, you would firstly need a really good course, a fairly high standard of training with as much information as possible. The theory is really very important, but the practical aspects of live blood analysis are also equally important because, you know, as you might imagine, if you're not able to take blood samples correctly, then your results won't be reliable. Now, your course needs to be comprehensive, and the equipment that you use, so your microscope system, needs to be up to the correct specifications, so you're able to use live blood analysis to its full potential from the beginning. Now, I've often seen people who want to add live blood analysis to their practice, but who don't want to invest in a good enough system. So they start with a very basic system that doesn't really allow them to see everything that they should be able to see, and they never really then fully benefit from live blood analysis. So, you know, in summary, the theory, the practical proficiency, and the correct equipment are all very crucial to get started. All right, and then Elizabeth, I think you have some information for us on the training course specifically as well.
Yes, I do. Yes, thank you very much for that, Dr. Ocker. So, Live Blood Online and Neogenesis Systems has been teaching naturopathic doctors and practitioners all over the world for the last 3 years, although Dr. Ocker himself has been teaching for 18 years. Dr. Ocker is the tutor of the course. The course was put together with the convenience of attendees in mind, obviously with no expensive travel and accommodation expenses required, but most importantly, we found that being able to repeat the lessons was very helpful for attendees in learning this technique. For that reason, all of the lessons are recorded and students have access to them for as long as they need. This also helps if attendees have to miss a lesson, or if the timing of the lessons is inconvenient, or if they just want a refresher. The in-house or in-situ courses tend to leave students with just a microscope, a manual, and what they can remember. Usually, just not enough for students to feel that they are proficient or confident in practicing live blood analysis. So at Live Blood Online, we offer 12 live interactive webinars with questions and answers throughout, with all the backup and support needed, and as I say, with all the lessons, the recordings of the lessons being sent for the students for as long as they need them. We also supply a 500-plus page manual, 2 wall charts to identify anomalies, live blood and dry blood, and we also provide a training site where attendees will find a library of pictures and videos to help them along, with lots of useful information to help them in their practice. In the first module, we teach students how to use the microscopes and how to set them up and be able to use them proficiently and confidently. We also provide backup and a private Facebook page where attendees are able to post their findings and learn along with all the other present and past attendees of live blood analysis. So attendees can study from the comfort of their own home or office or practice, and at their own pace in their own time, getting all the backup that they need. The course is very comprehensive. It covers all aspects of live blood analysis, including the pleomorphic and medical perspectives, and it provides specific treatment protocols. The course is CMA approved, that's Complementary Medical Association, and we award a certificate at the end of the course on submission of 2 test cases. We've successfully trained many health practitioners from all around the world, and practitioners certified by Liveblood Online and Neogenesis Systems have been trained to a very high standard and level of proficiency. So if you'd like to know more or have any questions, please contact us at info@livebloodonline.com or visit our website, which is www.livebloodonline.com. So I think that's all. We don't have any more questions. Thank you very much for your time. We hope you've enjoyed the webinar, and thank you very much, Dr. Ocker. Do you have anything to add to that?
Yeah, I think that really sums it up, Elizabeth. I think in terms of the training course, it is also probably important to mention that the course is quite a comprehensive course in that we've included information from all the leading schools of thought in live blood analysis. So often what would happen if you were to study live blood analysis somewhere, you would tend to just learn one researcher's perspective. For example, many of the courses are mainly focused on pleomorphism. Some courses are really only focused on the nutritional aspects of blood analysis. So in our course, we've really combined all the schools of thought into one comprehensive course, and that gives practitioners the ability then to fully understand all the anomalies that they then see, when they're looking at blood samples.
Okay, yes, thank you very much for that. Okay, so as I say, thank you very much for your time. Thank you for joining us, and we hope you've enjoyed the webinar. So it's thank you and goodbye from me, and thank you very much and goodbye, Dr. Ocker.
Thank you very much. Bye-bye.